Cardiology has quietly become one of the most data-dense fields in medicine. Every consultation, every image, every ECG generates signals that no human can fully read alone, and that's exactly where AI is starting to change the practice. My guest today is Dr. Benedict Glover, a cardiac electrophysiologist who has spent his career on the front line and has now built an AI tool of his own. So we'll look at where AI in cardiology is real versus where it's hype. We'll also look at what it means when a clinician decides to become a builder and how that changes its practice. Dr. Ben, welcome to TechAnatomy.
Thank you.
You've spent your whole career in electrophysiology, but before we talk about your area of expertise, I wanted to know a little bit more about the use of AI in cardiology in general. Where do you see it delivering on its promise, and where do you see it fall short?
So that's a good question. So currently in cardiology, we deal with a lot of data. We deal with lots of numbers, ECGs, echoes, and it's very hard to interpret that data as a human. In fact, we probably lose a lot of it as a human. So I see artificial intelligence as being a model which can look at numerical values and help aid the clinician. And we're using that already. So when you think of Holter monitors where the patient has a monitor on for a long period of time, there's so much data. Some of these can be 14 days long, and they're using artificial intelligence to look at patterns so that those patterns can then be registered to the physician, who then looks at it and says, yes, that's correct or that's wrong. So I see it as a sort of an automatic background process. And actually even in the electrophysiology laboratory where I perform procedures, we collect lots and lots of information inside the heart. So if you imagine like with a regular ECG that we perform, there's like 12 different leads. There's 12, it's called a 12-lead ECG. When we go inside the heart and record electrical points, we could record 30,000, 40,000 points, which is a lot of information over a small area of maybe 4 centimeters. So actually, I've noticed we're starting to use it there to predict where rhythm issues might occur, to kind of help us guide where the problem might be. And it's certainly cutting down on procedure time, and it's helping us a lot.
We've seen a lot of headlines saying things like AI can read normal-looking ECGs and find a problem and things like that. Can you help us tell what's real and what is not, and what the studies actually say?
Yeah, so the ECG is a good example, right? We've had an ECG for hundreds of years, and in my opinion, it's one of the most useful investigations, and so simple as well, right? So whenever I look at an ECG, I'm looking at it with years of experience. Like I have basically programmed my brain to look at different patterns, which is helpful, but that's not super helpful because lots of other people haven't, right? So lots of doctors and other specialties haven't, and they can't necessarily interpret the ECG. And the very interesting thing about the ECG is the machine actually prints out at the top its interpretation of the ECG. That algorithm is actually over 50 years old. So I always tell like my students, ignore it. You need to recognize the pattern. So we notice gross changes on an ECG. We look at the ECG, there's different waveforms, and we sort of look at the atrial contraction, ventricular contraction, and all of these things. But whenever you think like, what is an ECG? An ECG is actually lots and lots of electrical points inside the heart. And it's like a massive Excel spreadsheet. So it's recording lots and lots of action potentials inside your heart, putting them all together. And when you add and subtract and multiply, you end up with your ECG. So the AI can actually look at those individual points, which we can't even see, and it can predict things that may not have necessarily happened. Like, for example, if you have an irregular heartbeat, I can look at your ECG and go, you have an irregular heartbeat. But AI potentially could look at your ECG and go, it's normal, but you are at somewhat of a risk of developing that irregular heartbeat. And that's where AI may be really helpful and may be superior to humans in many regards. The bigger question then is, what does that actually mean in clinical practice? If I say to you, you've got a 70% chance of atrial fibrillation, is that helpful or is that stressful? Personally, I think it's helpful because you might then say, well, I'll change my lifestyle, I'll exercise, I'll change my diet. So I think we have to use everything in common sense. And I think for sure the AI models can predict things, and like this has been widely studied in the Mayo Clinic. They actually got a massive cohort of patients in South Korea who all had ECGs and echoes. They put all over 1 million patients. They put it all through their database, and they were able to predict ejection fraction, which is normally only something that's the strength of the heart contraction. It's something you can only predict normally on an echo. They were able to predict it based on your ECG without even doing an echo. And then they actually thought, well, it was about 90% effective. Can we make it better? Will we add in like gender and age? It was able to predict your gender just from your ECG. So yeah, so AI can definitely see data that we can't see, but we need to interpret that data.
Does it help you discover new things and look at an ECG or an image differently? Because I've seen this example once where you had this heat map that you usually get with AI, where it tells you sort of where the AI is looking to identify something. Yeah. And it was looking at a place that doctors in general don't look there, but that's where it found the information. Does that help you understand how to maybe diagnose differently or other things that you didn't imagine?
I think so. Like, I think on the very basic level of AI, I think for sure it can make a better diagnosis than a lot of clinicians who aren't specifically trained in cardiology. I think it'll at least encourage them to look more deeply, whereas at the moment the algorithms are so bad that we actually almost discourage them from looking. Like if it says acute myocardial infarction, it may not be, it may be. So that's not helpful, whereas AI I think will help that. So it will encourage the clinician to look, okay, it says inferior, I'll look at the inferior leads, and that'll make life a lot safer. If it's seeing subclinical events that I can't see with my eye, that's going to be tricky. That's a tricky one. And does it mean I'll treat the patient differently? Perhaps, because perhaps if it says, your risk of, left ventricular hypertrophy or heart failure or AF is such and such a percentage, I think primary prevention is going to change a lot. And whereas I might sort of say at the moment, yeah, you're fine, don't worry, I might go, okay, you need to go on this medication, that medication, exercise, and all the rest of it. So I think that's where I can see it as being very helpful. But we still need to be the end result. We still need to make the interpretation. Like the issue with medicine nowadays is not lack of information, it's lack of understanding of too much information.
And there are two biases that are usually described, over-reliance and under-reliance on the results coming out of these machines. Yeah. Do you have any advice for the physicians listening to this into how to use these tools and how to know how much trust you can place in them?
Be skeptical of everything. But that should apply to everything in life. Be skeptical. Go with your clinical instincts. If something doesn't make sense, don't trust it. But don't also be against artificial intelligence. A physician, I don't think artificial intelligence is going to replace physicians. I think that's pretty widely known. But I think physicians who embrace artificial intelligence will replace physicians who don't.
But lead with skepticism still.
Always. You always have to. I mean, if you're a good clinician, you're suspicious of everything. You're like a detective. You're on a show, you're trying to figure out who killed this person, that. This is exactly the same principle. You keep an open mind, you have your differential diagnosis. If AI comes up with something completely irrelevant, then yeah, of course you have to question it, right? But the problem with AI is that it generally doesn't. When it's wrong, it's not grossly wrong, it's very close to the truth. And that's the really tricky part, because it's really, really easy to spot something that's obviously wrong. It's very hard to spot something that's very close to being true.
I read a study recently, it was in radiology, and it was explaining that the use of AI in reading images helps physicians read more images and detect faster. But at the end of the day, it doesn't really improve patient outcomes, because everything that comes after reading an image is still lagging behind and is still not efficient. Do you see the same thing happening in cardiology?
Perhaps, but the way I even see radiology has always been the classical example where AI can, in some regards replace the clinician. The best use of AI I've seen in radiology is where it alerts the radiologist to something that's very problematic. So in other words, if they have done, let's say, 100 CT scans that day, rather than going through each scan number by number, AI is very helpful in saying, look at this one first. There's a tumor in the lung, you need to look at this one first, report it. If that happens quickly, it's alerted to the physician, then that has to improve patient outcome. That has to, because you've picked up on something a little bit quicker. I think on the bigger scale, do any of these things overall improve outcome? That's to be studied. That's to be studied. Like, we need more information on that. Like, just by getting a quicker diagnosis or a more accurate diagnosis, does it mean the patient gets a better result? Like, you would think so, but possibly not. So we need to do research. Like we're lagging behind in research. That's where we're lagging behind. We need more research in artificial intelligence in healthcare. And that to me is like what we really need to look at.
Research driven by whom? Is it like tech companies? Is it physicians? Who should be doing
physicians?
it?
Physicians. It has to be physicians. And that's the biggest issue, right? It has to be physicians. Like tech companies don't really know what the problem is. Like, I get people every day coming to my clinic and telling me they've got a solution for something, and I'm like, that's amazing. You're a very smart person, but that's not a problem. Yeah, sorry to tell you, that's not a problem. Whereas I can see the problems because I work with the problems every day. So if I can find the problem, then I just have to go. It's actually easier to find the solution than to find the problem to a problem that doesn't exist.
Well, the reason I'm asking is because you found a problem of your own and you created a solution. Can you tell us more about that?
Yeah, like I find problems. Like, I'm amazing at finding problems. So I find problems like every day, probably too many. But my biggest problem was that basically I felt like there was too much information available to patients, to healthcare workers and to students, which was largely irrelevant. So if you typed a question on, you could come up with radically different answers. And I had lots of patients coming to my clinic, asking about this and that and the other thing. And I don't want to discourage patients from information. I want them to get information, but I want them to get accurate information. So I felt like, all of the big, large language models, like, they can give you lots of information because they can go through everything on the internet, but that doesn't help. How does that help? It doesn't help the doctor. It doesn't help the patient. In fact, it often leads to more stress and bad decisions. So we came from the inside out. So we went, okay, what we need is accuracy. So whenever you read a paper, a manuscript or a book, you have a thought process. So you look at it like, what's the impact factor? How many people read this? Who are the authors? Is this randomized controlled study? Is there any bias? So those are the things that you have in your head. So we basically developed an algorithm that goes through every single publication and basically gives it a score or a grade. And only if it achieves a certain mark is it then put into our system as information. And we've combined that with speaking to experts in the field. And something that I find remarkable is that a lot of clinicians retire. And actually a very famous cardiologist retired, and he said to me, no one talks to me anymore, no one asks me questions anymore. I became irrelevant when I retired. And I was like, this is crazy. You have years of information. We need to get you and all your buddies to come and give us your brains and put it all into this. So we have a section of expert opinion. So we have expert opinion, we've got guidelines, we've got patient experiences, we put it all together and we read it, we review it and we check it. And that's what's different. Big companies can't do that, I don't think. We're doing it as clinicians. I don't think, the large tech companies can do this. I think they can give you lots of data. Is that helpful? I don't think so. I really don't think so. I think what's more helpful is accurate, useful data from an expert. And the thing I really love about this idea is that this can roll out to anywhere in the world. It doesn't have to be, Europe or America. This could roll out to Africa, Asia, like South America. And like, there shouldn't be an obstacle to medical information. There shouldn't be an obstacle. I think artificial intelligence has actually brought, let's say, healthcare in Africa up to the same standard, not to the same standard, but to a similar standard to what you can get anywhere in the world, which I think it's bridged that gap immensely. So my dream would be that would be available to everyone in the world, so you can access data. And we've made it in such a way it's not just cardiology, it's respiratory, it's gastroenterology, neurology, infectious diseases, also tropical diseases, all sorts of stuff. So we've made it pretty open.
What I think is really interesting is that you have a mix between what AI can produce and what is great about AI, but also about what human experience can produce and expertise. And this is something that I sometimes discuss with doctors who are asking me, do you think I'll be replaced by an AI? And my take on this is that if you stop developing your own expertise, then probably. But if you continue developing, you will always be needed independently of AI or not AI.
Yeah, and that's so true. Like one of the things I find the most difficult about this app that we've developed is trying to understand how I make decisions. Once you have to put it down on paper, for your programmer to kind of go, this is how my brain works. You suddenly realize like a human brain is very complicated. It's full of experience. It's full of, different cognitive features. No one really actually understands how the human brain really works and how it retrieves data. It's not a computer. It's not artificial intelligence. Artificial intelligence is a lot of fancy math. The human brain is different. And I think for now, we have to combine the two, and maybe someday it'll change, but I don't think anytime soon.
And how do you test these apps before giving them to physicians? Is there like a process that you go through?
Yeah, so basically there's all sorts of regulations. So we have developed this as an educational app, and I've put that through our local authorities, and they're happy with that. Once it starts to help make clinical decisions, it actually becomes a medical device, and that gets quite complicated. So that's kind of the next level that we're working on. So we're actually working on making a medical device out of this, but you need to collect your data, do your randomized studies. I have a massive patient population. I've had lots of people volunteer to test stuff out, but I need to get to that level where eventually I think this is a medical device, which is absurd in some regards because all of the large language models which patients are using to get advice, none of them are medical devices. None of them are medical devices.
That's very true.
But having said that, I want this to be different. I want this to be better. And I want this to be a medical device because I think there's more trust in the system if it's a medical device. And I think patients and doctors and trainees can see that we really care about the quality of information rather than the quantity of information.
And has anything changed about your sort of day work as a physician now that you're also a tech founder?
Yes, I'm a lot busier. I don't sleep as much. Not that I ever did. What I like to do now is if I get something really strange and complicated, a weird ECG or a weird clinical presentation, I put it through the system just to test it. And it's not as good as me, I have to say, but it's pretty close. It's getting pretty close, which is very impressive because you're not talking about run-of-the-mill regular stuff. It's actually starting to predict unusual things, which is absolutely amazing.
You sound very tech savvy and you're very interested in these technologies and what it can do to clinical practice. For those who are listening and who are not as familiar with all this, do you have any starting point advice that you can give them?
Absolutely. So there's sort of two different groups of clinicians, right? There's clinicians like me who are definitely the minority, I have to say, who are very tech savvy, who ask their patients to go out and record their stuff and send it through and record their ECGs and heart rates and all of that. And I love that. And then there's the majority who don't like that. They think it takes up more time. When can they scroll through all the data? I actually have found it makes my life easier rather than harder. When patients come up with their ECGs, I can open on their phone, go through the app. It makes the diagnosis more accurate. So I don't understand why you wouldn't encourage that. The algorithms on the wearables are pretty good for the big companies, pretty good, but they're not perfect. So, I have patients who send stuff through to me and I'll look at it and tell them, but I think we need something like, for example, if you want to record whether someone has a rhythm disturbance in their heart, you can put a little device under their skin called a loop recorder, which costs, somewhere from €3,000 to €5,000 as a device. I think healthcare systems have to turn around and go, well, you know what, you can get an Apple Watch for, you know, €500, or you can get a Cardia LiveCore for €150. And I think the healthcare systems have to look at smartware. And we actually have developed what's called a virtual clinic in Ireland, which I run, which is where patients, rather than being admitted into the hospital, they're sent home with a Cardia ECG machine, blood pressure machine, scales to weigh themselves, temperature probe and saturation probe, and they phone in twice a day with their OBS, and it keeps them out of the hospital. And patients love it. They actually love it. I've never had so many compliments from patients, because they're at home, they're getting exactly the same OBS that they would get in hospital, and they're getting like nurses calling them, checking with them, calling me. And I just think, and actually it's, when you look at it from a financial perspective, it saves an absolute fortune, because patients are at home. They're not in the hospital. They're not lying in a bed for no good reason. So I think you either move with that, or you're going to become a dinosaur. And that sounds harsh, but that's the fact of life. You have to move with the times. Medicine has changed a lot, even since I was in medical school. And I always say, like, if you don't keep changing and you don't evolve yourself, well, that's the whole process of evolution. If you don't evolve, then you're gone.
And last question for any physician who sees a patient, and that patient comes with insights from ChatGPT and Excel spreadsheets with their wearables. And if that physician is quite skeptic and doesn't know how to react to all this, and perhaps gets a bit frustrated and annoyed, do you have any advice on how to approach this? What are some of the things that this physician can say?
Like, wearable information is super helpful, and it takes absolutely no time whatsoever. Like, I've had patients come in, sit in my clinic and say to me, I don't feel very well. And I'm like, put your finger onto your Apple Watch and they'll record an ECG right in front of my eyes.
Really?
Yeah. And that takes 30 seconds, right? So it doesn't add to time. It actually probably takes away from time, because suddenly you have an answer and you have a solution to the problem. So I think the fact that people think that wearables and all that information, all the data actually increases physician workload, I think that's absolute garbage. I don't think it does at all. I think it helps. I think it reduces stuff a lot. Patients have every right to look up ChatGPT and Google. I usually tell them not to, because I think a lot of the websites are very inaccurate, and often from other countries where they're trying to look for business. So I usually tell them from the outset, don't look this up. If you have any questions, give me a call. But that's where our app comes in, right? I can turn around and say, well, you know, don't look this up in ChatGPT, because it's going to scare the wits out of you, and you're going to go into arrhythmia because you're stressed because of ChatGPT. But look up our app, and it'll actually tell you something helpful and useful and practical, and will probably make you a heck of a lot more relaxed, which is important.
Well, Ben, thank you so much.
Thank you so much. Thanks for the invitation. Very nice to meet you.
Thank you so much for following us on this episode of TechAnatomy. I will see you soon.